Hi, Silva. Nice to see you.
Hi, good to see you too. How are you?
I'm good. I'm so excited about your upcoming weekends in 2026 for Modern Sex Therapy Institutes. We have the first class you'll be teaching about is integrating GSRD therapy, 7 components. So, for those that don't know, gender, sexuality, and relationship diversity therapy. Tell us a little bit about that class.
Well, I'm very excited about this because it's something that here in the UK we've been working on. And GSRD therapy used to be kind of some extra techniques to use or some extra knowledge to use in other therapeutic modality. But now we've actually made it a modality by itself. So GSRD therapy is its own modality, which is great. And it has 7 components, which is what I will be talking about. But also it can be integrated in the other modalities. So that's really great to know that it's not about learning a whole new type of therapy because the therapeutic kind of philosophies will be the same, but it's really getting to know more about the specificities of working with sexual diversities and relational diversities. And that's really about understanding about oppression, the role of oppression, understanding social justice, that's really, really important, understanding the role of shame and grief, understanding sexology, because so many of our LGBTQ clients will want to talk about their sex lives. And so many therapists don't know how to talk about sex. And to have those kind of like GSRD specific theories that we have to know about when we work with these populations. For example, the theories of minority stress, which is, a very central one.
Can you tell us a little bit about that one?
Yeah, minority stress is really this kind of like a very specific type of stress that happens with people who are minoritized. And so it is, there's like a proximal stress and there's distal stress. And those are basically the components about the stress that we can feel from external stress. So the external stress will be fear of discrimination, for example, will be fear of rejection. And that's obviously happening out there because there is a lot of still homophobia, biphobia, and transphobia out there. And then there is the proximal stress. So that's the internal processes. And that's basically when we internalize the stigma ourselves and we start to have thoughts like, I'm not good enough, I'm bad, I should be better, I should be different. And also the internal stress of feeling like depression and all this other stuff that comes with having a sense of not as good as.
Yeah, and so important. And I like what you said at the beginning is that, you're going to be talking about this therapy, which can either be used if someone doesn't already have a model that they use with clients, or if they do, it can still be integrated, right? So
Yeah.
you don't have to choose, which model you use, you can integrate this into the way you already do therapy.
Exactly. Whatever original training you have, you can really integrate all those components into what you already do. So it's not changing how you work completely, but it's just really paying attention to certain elements that we tend to overlook in when we work with the populations that are the dominant populations in the West.
Yeah. Can you give us any teasers of things people will walk away from?
Well, I will be just giving some examples. For example, some kind of like a typical example of some things to think about. For example, if there's a couple that comes in, it's a heterosexual presenting couple. So that would mean that one person is presenting as man, the other person is presenting as woman, and they come to your consulting room for couple therapy. Do you automatically assume they're heterosexual? Do you automatically assume they're monogamous? A lot of therapists will not be asking those clients about their sexual orientations or their relationship orientations because they will make an assumption that a heterosexual looking couple will be heterosexual. But in fact, this couple could be one or both of them could be bisexual, one could be asexual, one could be questioning. And we know in research that if the therapist does not ask those questions, the clients won't disclose. And so for a long time, therapists can be working with an assumption of the client's and the couple's sexual orientation and could just be going into the wrong path just because those questions have not been clarified at the beginning.
That's so important. Thank you so much. I'm excited for this webinar, which will be live and recorded and for the entire weekend, 2 of them. So thank
Yes.
you.